Hey guys, I am the nurse Tutor Asia, and today we are doing something exciting. We are learning how to put IVs in. I know that every nursing student is so excited to learn how to put IVs in. So let's get started. So first, what do you need? You're going to need a patient. So we got our patient right here, and you want to make sure that you verify your patient and verify that you actually have an order to insert an IV. And then we're going to get us an IV start kit. You're going to get you a saline flush. You're going to get an IV extension tubing. And then you're going to get your IV catheter. So this right here is a 22 gauge. All right, we're going to put that to the side. And then we're going to perform hand hygiene. And then we're going to put on our gloves. All right, so first what we're going to do is we're going to try to locate a vein without applying the tourniquet. So you just come to your patient and just start to look on their arms. You can look on both arms, but just try to locate a vein. Now, in some patients, you will be able to find the vein without applying the tourniquet. So that's what we do. When we find a vein, we want to press down on it, and we want to make sure that it's spongy. We want to make sure that it got a little bounce to it. We don't want to pick any hard veins. Okay, so when I do that, I also travel up the vein, looking for a good one. Okay, these are some good ones. All right, so then you want to open up your kit. So each IV kit is different. So this IV kit has some gloves in here. It has some iodine ointment in here. And then we also have some chlorhexidine. This one has a chlorhexidine wipe. But you normally would have like the chlorhexidine that you can like push and like actually scrub with. But we're going to use what we got. And then we have an alcohol pad. We have some tape. We have a tourniquet. And we have our dressing. So what we're going to do first is we're going to get our tourniquet out. All right, so I'm gonna go let's see, I'm gonna go right up here. So I'm gonna go for this vein right here. So I'm gonna tie the tourniquet up. I'm gonna go up some with the tourniquet. So I'm gonna let the patient know that, hey, this tourniquet has to be tight. So I always do my tourniquet like a bunny ear. And that way, you have that one release. So when I pull down this tab, this will come off. All right, so I want to go back to that vein. Okay, so now that I have the tourniquet on, I can see it real clearly. All right, so I think I'm going to go with that vein. So now what you want to do is we want to go ahead and let the tourniquet go, because we haven't prepped our supplies yet. So we don't want this tourniquet just sitting on the patient's arm while we prep all our supplies. We've already found our vein, so we're gonna let go of the tourniquet. All right, you see how it just easily came off? All right, so now what we're gonna do is we're gonna gather and prep our supplies. So we have our dressing. So what I like to do is I like to just take that off, and I like to just sit it right there on the patient's bed. That way, I have easy access to it. Now we're going to take our extension tube and our flush. And we're going to get the little air out of our flush. What we'll do is we'll alcohol wipe this part of our extension tube. Let it dry, and then we will connect it. So once we connect it, we now want to prime the line. I'm going to sit this to the side in its little cap. And then we have it ready to go. All right, next what I want to do is I want to get out my piece of tape. So we're going to get our needle, and we're going to open up that. So we're going to pull it off, and we just want to inspect our needle. And then also you kind of want to make sure that this little part right here is loose. And then you want to make sure that the bevel of the needle is up. So that's just meaning that little splint, you want to make sure that it's up. So we're going to just go ahead and sit this in here until we're ready to tie in our tourniquet. All right. So our tourniquet is tied. All right, so now we're going to take our chlorhexidine pad, and we are going to scrub that area. So we're just going to scrub that area. Also want to make sure that your patient doesn't have any chlorhexidine allergies, okay? All right, you're going to allow that to dry. Tell your patient that they will feel a little stick. So what you're going to do is you're going to grab your needle. So then you're going to look. So wherever we're going for our insertion point, we cannot touch that area because we have already anchored that vein down. So just pull on the bottom up. You see I'm like pulling it down. And then you want to at an angle like you would be writing. All right. So then you want to tell the patient you'll feel a little poke. So then you want to insert and you're going to get blood return. Once you get blood return, you want to then start to thread the catheter. So that means just push it all the way up there and then our needle comes out. Now, once we've done that, we want to go ahead and let go, hook the patient up to the extension. So what we're going to do is we're going to push some saline in. And what we're looking for when we're pushing the saline in is we're going to look and see if there's any bubbling happening. Is there any leaking happening? So we don't see any bubbling or any hardening or any type of rising right here. So that lets us know that our IV is good. So we could use our tape right here just to help us anchor that down. But then we will take our transparent gauze, our transparent dressing, and then we would just place it right over here. So we want to cover the hub. All right, so you want to get this down there really good. So you want to make sure that you're covering this little area right here. So then we would just take the sides off. All right. And there you go. And then we can finish flushing the rest of this since we already have it there. And then what we would do is we would just wrap it around right here. So we then can take our piece of tape and help tape it down right here, just so it just don't be rumbling all in the bed with the patient. So then you want to go here. It has your date and time on here. So you would just put the date and time. You'll peel this off. And after we flush our IV, that we take this little clamp and we close it. If not, you will see a bunch of blood backflowing in the tubing. So remember, always clamp this off when not in use. So the next thing that you would do is you would put on your little swab cap. So this cap right here, it just keeps it free from infection and things like that. This is how your IV should look. All right, so let's say you then get a physician order to discontinue this IV. What are you going to do now? So you don't need anything fancy for this. All you would need is just a gauze. And then you would just need a alcohol wipe. So the reason why we would use a alcohol wipe, and it's just to loosen up around here. So what we'll just do, loosen up the tape. So what we just take our alcohol wipe, and then we would just get where the tape is and get it nice and just moist. That way it loosens up, the tape, and you're not actually giving your patient a wax. So we just want to get all up under there. All right, so then you want to just peel it off the patient's skin. Make sure you hold it down. All right, you're going to take your gauze pad and you're just going to apply pressure at the insertion site. All right, you tell your patient, I'm just going to pull it out on the count of 3. 1, 2, 3. All right, so once it comes out, you then want to inspect your catheter to make sure that it's whole. And then you want to place this in the sharps. And then you want to hold pressure. So you know that you would have to hold pressure longer if the patient is on a blood thinner or if that patient has any type of clotting issues. All right, so next what you can do, you then can put a little piece of tape right here to hold this in place, or you could put a bandage on the patient. All right, you guys, so I hope you learned how to not only insert an IV, but to discontinue an IV as well. Thanks for watching.